Hi everyone, my name is Kaylee and I am one of the physical therapists here at Breathe. I just wanted to jump on today to share with you another service that we offer here at Breathe. So what we're going to be talking about today is clogged milk ducts and how we can help you with ultrasound. Ultrasound is one of the tools, modalities that we use in this physical therapy clinic a lot for clogged ducts. A lot of physical therapists use it for a lot of different purposes, but it's definitely, when we're seeing a lot of postpartum mamas, it's a hidden gem that we can use for that as well. So first is talking about clogged milk ducts. So when you would want to come in for this kind of service, a lot of mamas experience clogged milk ducts. So if you feel like, say your baby just slept through the night and you're like, yes, I got some more sleep, but you wake up and you have like red, warm, it's tender to the touch, and you can feel like a hard lump. So before it gets to the point of mastitis, when you just have this clogged milk duct, there's a couple things you could do before you come see us. You can kind of wait it out a little bit, see if you usually resolve them pretty easily. You can kind of wait 24 hours and see how it goes. You do a lot of nursing, so if you are breastfeeding, breastfeed that baby, or if you're pumping, pump as much as you can, trying to get that flow. Do a lot of massage, so like right at the clog and kind of then working your way back. So instead of thinking like a traffic jam, like you're just shoving at the back and shoving all the cars forward, let the first car go and then everything can start going more. So start right at the clog and then kind of work your way back, and it's gonna be tender, but you just kind of gotta get in there. Warm baths, Epsom salt baths, warm compresses, dangle feeding is good so that gravity is helping, or angle the jaw of the baby towards the clog. I'm just going over here because this is where I had one, so that's where my instinct draws to. Is so maneuver whatever, if you need to lay on your back or if you're sitting, depending where. Clogs can be all the way around in any of the milk ducts. And what it is it's what it sounds like. It's a bunch of the milk that has been clogged up in that duct, and we want to get it resolved, get that flow normalized again before it gets to the point where now that clog gets infected and it turns into mastitis, which is infection in the milk duct, which gives you terrible flu-like symptoms. If any of you guys have had that, you know what I'm talking about, and it really sucks. But so if you're trying all these home remedies at home and it just doesn't seem like anything's working, give us a call. So what we do here is we use this ultrasound. So if you've seen ultrasound for other things at other clinics, you know what I'm talking about. It's got this nice little head, nice little device. When you come in, the first appointment would be if you're coming in just for a clogged duct. Like, I woke up, I can't get it to go away, I'm scared it's gonna turn into mastitis, it really hurts. Can I please just come in? Yeah, sure. We'll fit you in a 30-minute time slot. So you'd come in, we talk about, okay, tell me a little bit about what's going on, where is it at, when did it start, what have you tried at home. We'll lay you on our plit and angle you at whatever angle we need to for gravity to be on our side. So if it's underneath your breast, then maybe we'll have you at a little bit of a downward angle. If it's on the top, then we'll lift the head of the bed up, so gravity is helping us. If you need to lay on your side, either side, we'll position you, help you position the right way that we need to. Then I'll step out of the room, or whoever is your therapist, will step out of the room, give you a couple towels to be able to drape yourself, take off shirt, bra, drape yourself so that you're just exposing where the duct is, or the clogged milk duct is. Say, hey, I'm ready, we'll come back in. When we come back in, we'll set this up and we'll use this ultrasound for 8 to 10 minutes, typically we'll do 8, right on where that duct is and working in there. Again, it's might not be the most comfortable treatment because it hurts, it's tender to the touch, but we're trying to use the ultrasound to help break up that area of restriction. There's research article, I was reading a research article talking about all of this stuff, and when we started these services, and it was talking, they had 25 women come in who all were experiencing clogged milk ducts. That's why they're in the study. And they had 23 out of the 25 women had their clogs resolved with therapeutic ultrasound. They also showed how many treatment sessions they needed to resolve it. On average, so it ranged, there's a range, but the average amount of treatments that were needed was 3.3. So an average of 3 sessions. So what we recommend at Breathe is, if you have the time, and it can be weird if you come like on a Friday because we're closed on the weekends or things like that. But ideally what we would recommend is come in for the first appointment. It's 30 minutes, $50 for the first session. We recommend a total of 3 based on the research. So the subsequent appointments are only 15-minute long. Those are going to be at a cheaper price. You'll come straight in, here's your towel, let's get back into the same position we did yesterday. We'll do your ultrasound, charge that at a different rate. So in an ideal world, you'd come 3 days in a row. First is 30 minutes, the next 2 are 15 minutes. We'll also give you stretches that you can do. We'll give you this fun handout that we've made for stretch ideas. It tells things you can do at home, some of the things I talked about, some more ideas to help relieve your pain and get rid of your clogged milk duct before it turns into mastitis, because nobody likes mastitis. So yeah, shoot us a comment if you have any questions. We'd love to talk about it. We love to help all of our mamas, especially along their breastfeeding journey, whether it's pumping or nursing, anything that leads to a clogged milk duct. We would love to help you with it.